Hi, welcome again to our Thursday Coffee Talk. This is our days where we like to educate you and kind of show you guys what we're doing here at Bella LA. I have a very special guest with me today. This is Averys Clark. Welcome, Averys. Averys wanted to share a little bit about her experience that she's had here with me at Bella LA. And Averys, what brought you here to see me?
Yes. For the past couple of years, my acne had been very, very bad. I was afraid to even go out in public because I was embarrassed about how I looked. I tried many regimens in the past, and it just seemed to get worse and worse every single time. None of them worked. So we heard about this place, and my mom had talked to Miss Diane, and we decided we were going to give it a try because at that point I was desperate for anything to help me fix it. And that's how we came here, and I started my treatment plan.
Awesome. Well, so can you tell my audience out here a little bit about the treatment plan and the approach that I kind of took with you, and how you were able to do it and how you felt about it?
Yes. So when I came in here, I was a candidate for Accutane. Is that correct?
Mm-hmm.
Yes. My skin was very red and irritated, and we decided that I wasn't going to do that. I wanted to do it all topical. We did have to do a little bit of oral. We put myself on antibiotics,
Mm-hmm.
and that seemed to speed up the process a little bit. But mostly I just wanted to do regimen. I do have 6 steps in the morning and 7 in the afternoon, which can be a little long. But ever since I started, it's been a part of my process and part of my routine, and it's helped a lot.
Great. So once you kind of got used to the regimen, and yes, it kind of was lots of steps, did it speed up? Or did it kind of not get as long when you kind of got used to knowing what steps to do and which products to use?
Yes. When I first started, I had to go back to the plan and be like, okay, I got to do this step first and then this step. Once I got used to it, I know which one I need to use and when I use it.
So I had put Averys on a ZO protocol, a very stringent acne protocol. We also, like she said, she was kind of really had that cystic inflamed acne that if, let's just say I was a dermatologist, she came to me, she really was an Accutane candidate. Her and her mom did not want to do it. So we took a little bit of a longer process to get there, but she was okay with that, with the regimen at home. But I also brought her into my office about every 2 to 4 weeks for some extractions to really calm down the redness and to get the active acne under control. And how was your experience with those treatments that we did here?
Oh, and here, they're incredible. Every one of the people that I've met in here have been wonderful. They've told me like what they're about to do and how it's going to work and the process. And it's just made me feel more comfortable here. And it's been amazing.
And you got great results after your treatment.
Amazing results.
So those results, we usually would have her come in for an ZO acne stimulator peel, which is a very mild peel. We would get any extractions out, and then we also would alter that with some hydrofacials, which I know you've seen our hydrofacials on our social media posts as well. It's a great treatment plan that actually would really get some of these extractions out. We don't typically do hydrofacials when she was really, really inflamed, but as we get everything calm, she would do the hydrofacials, and she really would start clearing up. So that's awesome. So are you really super thrilled with your results?
Oh yes, I'm finally comfortable in my own skin. It's been amazing. I barely have to put on any makeup now, and before I had to like take it on to even like look even decent to go out. Nowadays I just put on a little concealer and some eyeshadow and mascara, and
you're absolutely beautiful. You look so beautiful. I'm so happy for you. Too, yes, we did treat her with some oral antibiotics as well, and I do want to say that we were able to get her off of that. So a lot of times a good treatment or a treatment plan that a lot of providers will put acne patients on is antibiotics for long term. I'm not a big believer in that, where I just think because that can mess with your gut health. So we did start that to just kind of get her some results a little bit quicker, but we were able to get her off of that. One thing I am an advocate of is to give you a probiotic to take while you take an antibiotic to protect your gut health. So I was glad that I was able to do that for you to speed up. We have been treating since October as well, and your great results, you were pretty happy in when, like December, January.
Yes, it was pretty early.
And then, yeah, I mean, she saw results sooner, but it really didn't. It was maybe less than 6 months that she got to where she wanted to be. So Well, great. Well, thank you for joining me today, Avery. I'm so happy that you have been able to achieve the results and that we can continue to be here for you.
Thank you.
Yes.